Dr. YONATAN Tedla, a full-time urologist at Baho International Hospital. Today, I will tell you something about the prostate disease. So first, I will start with what is a prostate. A prostate is a small gland which is a part of male reproductive system, which is found below the bladder and surrounding the urethra, the tube that takes out the urine and the semen out of the body. And the normal size of the prostate in men aged less than 40 is around 20 grams on average. So with aging, the prostate will increase in size. So once it increases in size, it might cause urinary symptom, or it might cause no symptom at all. And the size enlargement can also be due to the prostate cancer. So when the prostate enlarges and causing urinary symptom, and if we are sure it is not a cancer, we can call it BPH, which is benign prostatic hyperplasia, which is a non-cancerous enlargement of the prostate, which is common in old age, and usually it causes urinary symptoms. Okay. So when we see there are around 3 diseases related with this organ, that is the prostate. The first is benign prostatic hyperplasia, which is a non-cancerous growth of the prostate, and the other is a prostate cancer, and the other is a prostatitis, which is infection or inflammation of the prostate. So when we see the incidence of this disease, in men age 40 up to 50, around 40% of men in this age group will have histologic evidence of BPH. In men 50 up to 60 years, the incidence can reach up to 50%. In men 60 up to 70 years, it can reach up to 70%. And in men age 80 and above, it can reach up to 90%. But not all patients with enlarged prostate will have a symptom. And when we see the prostate cancer, it is the most common cancer in men, and it is the second most common cause of cancer deaths in men. So when a patient has enlargement of the prostate, which can be due to BPH or a prostatic cancer, they might have urinary symptoms. These urinary symptoms include difficulty of urination, increased urinary frequency in the daytime, and in the night time, the flow of the urine become poor. They will have straining. That means they will push down to start the urination, and they will have also urgency, which is a sudden feeling to urinate, and which makes it difficult to postpone urination. So they will have these symptoms, and others might not have symptom at all. They might have enlarged symptom, enlarged prostate, but no urinary symptom at all. And the other is the doctor will do a prostate exam, which is known as digital rectal examination, where the doctor inserts his fingers through the rectum and palpate the prostate, so that he can know whether the prostate is enlarged or not, or whether there are evidence of a prostate cancer or not, or whether it is painful or not. When it is painful, it shows there is some inflammation. And it might also cause complications like the bladder stone, recurrent urinary tract infection. It can also damage the kidneys if it causes obstruction and not treated early. And sometimes it can also present with bleeding per urethra. So when we come to how to diagnose and work up a patient with suspected prostate disease, first is we will take a history. We will ask them whether they have urinary symptom or not. Then once we will take the history, well, the doctor will do the digital rectal examination to see whether the prostate is enlarged or not, and to look for evidence of the prostatic cancer. And then they need some laboratory investigations, of which the most important one is PSA, which means a prostate specific antigen. So in case of the prostate cancer, it will be higher than the normal range, and sometimes also due to inflammation it can be higher than the normal range. And they need a urine test, also abdominal pelvic ultrasound to see to assess the actual size of the prostate. So after doing those laboratory investigations and physical examination, if there is suspicion of a prostatic cancer, they might need further workup, which might include an MRI, which is known as a multi-parametric MRI. On the MRI, if there is suspicion of a prostatic cancer, then we will do a prostate biopsy. So in the prostate biopsy, we can confirm the diagnosis of a prostatic cancer. It can also tell us about the grade of the cancer, which is important for the management. So when we come to the management, the first thing is to make sure that prostate enlargement is a cancer or not a cancer. So if it is not a cancer, we call it BPH, so benign prostatic hyperplasia. So the physical enlargement of the prostate by itself is not a problem as long as it's not a cancer. So when it causes a problem, that is a urinary problem, it needs a management. So the first line of management is with a medication, single or combination of drug that will improve the symptoms. But if the patient have enlargement of the prostate, not a cancer, and doesn't have urinary symptom, just simple lifestyle modifications like reducing the caffeine, reducing the spicy food, and reducing the soft drinks will improve the urinary symptoms. But if the patient have severe urinary symptoms that doesn't respond for the medication, or if they have complications like bladder stone, kidney injuries, recurrent infection, recurrent bleeding, they might need a surgery. So the surgery can be minimally invasive surgery using endoscopic approach, or sometimes when it is very big, it might need open surgery. And when we come to the prostatic cancer, so the management depends on the biopsy result and on the size of the prostate. So we will stage and grade the prostate. Then the management depends whether it is a localized cancer, locally advanced, or metastatic cancer. So the management can be just simple follow-up with doing certain investigations at certain time interval, or radiation therapy, surgery, or when it is very advanced, hormonal therapy, or it might need a combination of this. And when it is an infection, it needs long-term antibiotic with anti-inflammatory. So the first thing is they should visit a physician, if possible a urologist, to have those workup and to know whether it is just non-cancerous growth or a cancerous growth. Then we will assess the severity of symptom and will be given appropriate treatment. And the other important thing is the screening. So prostatic cancer, the incidence as well as the severity is very high in Black populations. So, and in those who has a family history of prostatic cancer. So in the Blacks and in those men who have family history of prostatic cancer, screening starting at the age of 40 to 45 with PSA, annual PSA, screening is recommended. And when there is suspicion of a prostatic cancer, they need further investigation like MRI and prostatic biopsy. So I will recommend those men age 40 and above to be screened for the prostatic cancer. This is all I have for today. Thank you.